Good morning. My topic is impact of diabetes mellitus and obstructive sleep apnea on severity of glaucoma. So my aim is to determine the association between diabetes mellitus and obstructive sleep apnea with the severity of primary open angle glaucoma. The materials and methods. The study design is hospital-based cross-sectional study for 1 year, and the study population include all diagnosed cases of POAG. So the inclusion criteria is patients between 40 and 75 years of age, all diagnosed cases, irrespective of their treatment status and current IOP status. And corrected visual acuity is 660 or better. Typical optic disc changes showing diffuse or localized rim thinning with neuroretinal rim loss, enlarged cupping, peripapillary atrophy, notching and disc hemorrhages, asymmetry in the cup disc ratio more than 0.2 between the two eyes. Then typical glaucomatous field defect as per Anderson's criteria on a reliable field which is done within the last 3 months. The exclusion criteria is history of intraocular surgery except uncomplicated cataract surgery, then regular use of contact lenses, then secondary causes of glaucoma like pseudoexfoliation glaucoma, pigment dispersion glaucoma, use of corticosteroids, previous ocular trauma, then the presence of other diseases that would cause abnormal visual field. Then the study design is hospital-based cross-sectional study, sample sizes 78 patients. Methodology, full medical and ophthalmic history is taken, best corrected visual acuity is done, slit lamp examination done to find out any anterior segment pathologies, intraocular pressure was measured by applanation tonometry, gonioscopy was done to grade the angles, reliable field was taken, dilated fundus examination was done, then assessment was made based on the HFA findings. Then the data was analyzed by SPSS software, quantitative variables expressed as mean and standard deviation, qualitative variables were expressed as proportions, and association was done through chi-square test. Then result, the mean age was 58.77 plus or minus 9.806. So the age distribution is most of our patients were more than 66 years, and the distribution of diabetes and OSA, the positive patients were 38 and those with OSA were 24. Then association with age and glaucoma severity, it showed a p-value of 0.0001 percentage, which is highly significant. Then for diabetes and severity of glaucoma, we got mild cases as 11 patients, then moderate glaucoma 14 patients, and severe 30 with a p-value of 0.042 percentage. That is also significant. Then association of OSA and severity of glaucoma, those with mild glaucoma changes were 8 people, and with moderate there were 5, and with severe 11 people. And so the p-value was 0.01 percentage. It is also highly significant. So moving to the discussion, the mean age of the POG patients were 58.77 plus or minus 9.806, and majority were above 66 years, which was similar to the study done by Al-Majawi et al. And the diabetes mellitus also showed a significant association with the glaucoma severity. So it aligns with the studies done by Pascal et al. And Cavazzi et al. OSA also had a significant association with glaucoma severity, and it aligns with the study done by Shi et al. So a statistically significant difference was observed between age and the severity of glaucoma. Diabetes and OSA showed a significant association with severe glaucoma, which highlights the potential impact of these comorbidities on disease progression. Hence, these risk factors should be considered while managing glaucoma. So these are my references. Thank you.
What, according to you, is mild, moderate, and severe glaucoma?
Ma'am, based on HFA findings and optic disc findings, we graded as mild, moderate, and severe.
That should have been more specific there. And how many patients had both diabetes and OSA? And among the patients who had obstructive sleep apnea, what was the severity of OSA? And how do you correlate? What was your
Ma'am, based on stop bank criteria, we took OSA.
No, but there's a standardized AHI index, right? So what was included, what was excluded in that? and how many patients had overlapping diabetes as well as OSA. The mechanism of how these conditions worsen glaucoma varies. So how did you correlate all of this together?
In the study design, you had a flaw. You took two variables and saw how much they'll play on a original disease. One of those variables is so very common that it's almost present in all of your patients. The second variable we are associating with another type of glaucoma called normotensive glaucoma. You are bringing it into POAD. So these flaws created a illusion which, Madam pointed out, how much of overlap between these two risk factors were there in a single patient, and in those patients, how much progression severity happened. These things you should expose, or else it just becomes like a status report on 30 glaucoma patients. That's all what you're saying. You're not telling us clearly what happens with these risk factors in a particular person and what happens when they compound, both the risk factors compound in a particular patient. Okay? Try to do that. Thank you.
Thank you.